Hi, it's the nursing professor. Welcome back to another episode of Fundamentals on Friday. So today we're going to talk about the urinary elimination system, and all of us have to urinate at some point or another. All right, so brief anatomy is that you have your kidneys. They empty into the ureters. Those ureters go to the bladder. The bladder is where our urine is stored until it's time for us to void, micturate, pee, whatever it is that you want to call it. Okay, the average bladder of an adult holds about anywhere from 250 to 400 milliliters of fluid. But of course, the older we get, then the bladder can become a little more sensitive where we're unable to hold all that urine. And we might have the urge to go to the bathroom a little more frequently. And when we have to go, we have to go a little more urgently. All right, so we're going to talk about those in a moment. As an infant and a toddler, we really don't have very much control over our bladder elimination. And so that is where bladder training comes into play. And so we frequently teach our toddlers how to, or when it's best to go to the bathroom, and we time them. We say, okay, they just woke up in the morning, let's go sit them on the potty. And eventually they learn what that feeling actually feels like to have to go to the bathroom, and they're able to accomplish that task. Now, in older adults, our kidney function typically declines just naturally, just by getting older. And the way we measure kidney function is typically with two lab tests, the BUN and the creatinine. We also need to look at glomerular filtration rates, but primarily those are the tests that can tell whether or not our kidneys are optimally functioning or not. As we grow older, we also typically lose some of the elasticity in our bladder and might have to go to the bathroom a little more frequently. Sometimes we lose some of the muscle in the pelvic floor, and we can't hold our urine for as long of a time. All right. There are other factors that influence our urinary elimination, and they include privacy. That's big time. Most of us don't want to pee in front of a whole bunch of people. Hydration, activity levels, make sure that your patient have adequate hydration. Their medications, frequently medications can lead to an increased need to urinate, like your diuretics in particular. And we want that person to have that outcome from taking diuretics because that helps to control their hypertension. Or it could help eliminate excess fluid from the body when we're looking at a person who has congestive heart failure. So diuretics do have very, very good purpose with them, but sometimes the irritation of having to go to the bathroom frequently will make people be non-compliant. So we need to make sure that we're assessing that when we're taking care of patients who are taking diuretics. Other conditions that can affect our our urinary system include benign prostate hypertrophy, BPH, which is frequently seen in males where the prostate enlarges and that person feels like they can't totally empty their bladder. They'll pee and stop, pee and stop. Also, other pathological conditions like cancer, trauma to that area can also impede kidney function. Decreased glomerular filtration rates can actually lead to a person needing dialysis. And there's two types of dialysis. One is hemodialysis, where that person goes to have dialysis outpatient 3 times a week typically. And we have peritoneal dialysis, where those people are taught to manage their dialysis at home, but it is a daily procedure that typically they have to do. So their families can also help with that. So now let's apply the nursing process. So we're doing an assessment. We ask the person how frequently do they go to the bathroom? Do they find that they have problems reaching the bathroom before they're urinating on themselves? We're getting some ideas to what the normal is for that person. We can have a physical exam done to that person. Diagnostic procedures like a bladder scan can tell if there's any excess urine sitting in the bladder after the person voids. We can get urine tests to test for bacteria. If the person has a UTI or urinary tract infection, that would show up there. if that person is excreting ketones into their urine, that can show up there. So there's a host of things that we actually can tell from getting a urine sample. All right. And we want to also measure their urine output, especially if we feel that they're not going to the bathroom frequently enough. And one of the tests that we use is a 24-hour urine test. Now, with a 24-hour urine test, you want to be sure that you have that person void first, then you start the clock for 24 hours. And anything after that time to 24 hours later, that is what we're actually sending to the lab for that amount of urine to actually be examined. All right. And so we come to our nursing diagnosis, and that could be risk for infection. It could be impaired urinary elimination, especially if a person is having episodes of incontinence. Risk for urge in urinary incontinence, those people who have that urgency that happens usually as a result of the pelvic muscles getting very weak in the pelvic floor. All right, so then we come up with a plan based on that nursing diagnosis. So the plan could be to, we want to find out more about how the kidneys are functioning, or what's the reason for their urinary incontinence or frequency. And then we come up with interventions, again, based on your plan. We're using ADPI. And your interventions could be anything from medication to making sure that your person urinates on a time, like every 2 hours, have them go and sit on the toilet. Make sure that they're in a proper position, because people to urinate, they need to sit upright in order to urinate. Men sometimes, especially the older they get, they need to stand. Even if they're in a hospital and you give them that urinal, many of them cannot urinate with just that bottle there, and they might have to stand in order to actually get rid of the urine. All right, so we want to monitor for distension, and we can palpate the bladder. Remember, the bladder is really low. It's in the lower part of your abdomen, and you can actually palpate there to see if it's full or not. If it is full, then we do have tests that you can do, bladder scans that can tell if there's an overflow of urine that remains there even after the person has urinated. When people have problems with urination, we can also use a catheter. The Foley catheter would be considered one that stays in for a longer length of time, whereas the in and out or intermittent catheter is one that goes in, lets the urine out, and then that's tossed away. Then we do it again, say maybe every 6 hours or every 8 hours, to make sure that that person is eliminating urine. Because of course, urine carries toxins, and we don't want that buildup of toxins to happen in a person's system. We also have another technique that we call Creed's maneuver, where you actually can teach the person to massage over their bladder to make sure that their bladder is totally emptying. The main point of it is this: we want people to stay as independent as possible when caring for their urinary system. If they need assistance, then that of course is provided. We also have things like stents. Urostomies are more of a surgical, artificial way that is done by a surgeon in order to help that person be able to urinate. And those will be placed depending on what the condition is. So sometimes people with cancer or trauma might end up with a urostomy, which is a tube that's coming out of their abdomen, which lets the urine flow into a bag, and then the bag is empty. We also sometimes have urinary stents, which work somewhat similar. That is going directly in the bladder and allowing that person to urinate. But the fact of it is this: people have to pee. They have to pee. And so hopefully that this helps you understand the urinary system and all the different things that we can encounter as we're taking care of patients. Never make fun of someone who has incontinence episodes. Just make sure that they're given the supplies necessary so that they don't feel that humiliation. All right. Well, if you like this video, please share, and I will see you next video. Bye for now.